spermatogenesis. So lifestyle modification plays a very important role in spermatogenesis. Is change the lifestyle. Stop wearing tight underwears. So stop wearing underwears made of nylon, thick material. Stop wearing tight jeans.
So we've clarified that a man with a single testis can get his woman pregnant.
Yeah.
But for men who want his testicular function,
Yeah.
what is your advice?
Yeah. But if there is already decreases sperm count, first we have to investigate why there is decrease in the sperm count. First thing is we have to do hormonal test, routine blood test, routine examination, and then the testicular scanning, color Doppler testis, color Doppler scrotum. This will rule out all other causes other than the testicular. That is, extra testicular causes should be ruled out. And once the extra testicular causes are ruled out, then come to the testis, find out the reason. If there is a reason which can be treated, treat it. For example, if it is an infection, treat it. If there is torsion, treat it. If there is cancer, treat it, like that. So, and if there is a grade 3, grade 4 varicocele, do surgery and treat it. So if there are treatable causes, treat the cause. If it is idiopathic, that is unknown cause, we don't know, all the tests are normal, but still the person is having the problem, then it is called as idiopathic. Then general measures come to the picture. Then the first thing is change the lifestyle. Stop wearing tight underwears. Stop wearing underwears made of nylon, thick material. Stop wearing tight jeans. So try to wear loose pants, loose underwears, cotton underwears, and in the night try to sleep without underwear.
This is just to cool the testicle areas.
Yeah. Keep the testis cool. Wash the testis, the scrotum daily 2-3 times. Shave the testis and keep it clean, cool, and take care as if it is your face. So how we take care of? Yeah, I am serious about it. Yeah.
I believe
though it looks silly, but minor care. Say all organs are equally important, including the anus. Unless we take care of these organs, many times we ignore. Many times when I examine the external genitals of the male, once I strip the underwear, there will be a lot of bad smell. They wouldn't have properly washed all these things, because the fecal matter, when they go for the toilet, it will all be sticky unless they wash very tidily. Keep it clean, keep it washed with good soap and water. Many times infections occur. Even I have seen the lice, we inside the scroll, the pubic hair, pubic lice have also seen, and forming so many what you call as the eggs lying there. So keep the pot clean, keep it cool. Then after that, the next one is eat a lot of vegetables, flavonoids, keratoids, where all colored vegetables and fruits, they contain a lot of isoflavones, lot of L-carnitines, lot of citrulline, and vitamins, vitamin C, vitamin E. They are all helpful for spermatogenesis. And if required, take some extra minerals, zinc, selenium, in the form of micronutrients. They will help. Even ashwagandha, shatavari, some of these herbal medicines, they also help spermatogenesis. But they themselves, they may not increase the sperm count. Directly, indirectly, they help because they help in the general well-being of the person. So, because they're all very, very important for the general health of the person. These fresh fruits, fresh vegetables, and the minerals, that is iron, zinc, selenium, they are all molybdenum. They all help because for spermatogenesis, all these are required. All vitamins, or B complex, vitamin C, vitamin E, D, they're all required for spermatogenesis. So good diet and exercise. Good exercise release lot of.
How is vitamin D related to?
Indirectly, not directly.
Okay.
Indirectly. All vitamins and minerals, they indirectly, they help the cells. They especially fast-growing cells like the ovaries and testes, they require a lot of vitamins and minerals, including vitamin A. One individual vitamin, if I give tomorrow, the count may not increase. But overall, when we replace these along with others, they do help. And lifestyle modification, exercise. Good exercise increases the testosterone level. Not very severe exercise, more mild to moderate exercise They help the person to release more of testosterone, androgens. And testosterone is a very important hormone for the not only sexual function, but for also the spermatogenesis. So good exercise. And the most important thing is obesity. Reduction of the obesity will help to increase the spermatogenesis because once there is obesity, cholesterol will be there. Cholesterol accumulates in the blood vessels. Once the cholesterol accumulates in the blood vessels, blood supply to the testis is decreased. Once the blood supply is decreased, definitely spermatogenesis is also decreased. So reduce the weight, diet, exercise, more of minerals, more of fruits, more of vegetables, and lifestyle modification, good healthy, and sleep. Sleep is another thing. For good production of the sperm, 7 to 9 hours of sleep is very, very important. And those who don't sleep properly, the testis, they will not produce the sperm in adequate quality and quantity. So sleep is very, very important. And avoid smoking, stop smoking, avoid excess alcohol because they are all dangerous not only for the general health, for spermatogenesis. And no drugs, please. No cannabis, no all sorts of. And these pan frog, these so many varieties of this, they all directly or indirectly they contain tobacco. They are quite injurious to the general health also and to the sexual health as well as for spermatogenesis. So lifestyle modification plays a very important role in spermatogenesis.
The good news is, I believe men can produce new sperm every 3 months with good lifestyle modification.
Yes, yes.
Right. Dr. Sharath, how will someone know if their, private parts are healthy or not?
See, self-examination. Self-examination of the scrotum, testis, epididymis, and penis.
How?
Every day, when you go for the bath, when you are taking the bath, shower or bath, so or even when you go to the urinals, toilet, just test both the testes. May not be daily, at least once in a month. You hold both the testes in your palm. Check up whether there is any extra growth. Once you start feeling the testes, you'll be knowing whether they are normal or not. And check up the size and check up the if there is any extra tumor mass or whether it is tender pain. So if there is pain, then immediately go to the doctor. If there is extra mass, if you feel that something hard is there, something spongy is there, something abnormal, you feel that it is not normal, then you go and consult the doctor whether it is normal or abnormal. Many times one may mistake the epididymis for an extra mass. Then the doctor will tell, no, if it is epididymis, don't worry. And feel the worms. If you feel lot of wormy-like structure inside, then you have got varicocele. So self-examination, especially with a little knowledge about this scrotum, first read about this scrotum and testis from any general Google search. You will know how the testis will feel. So they are firm to soft, not too firm, not too soft. So check the whether it is tender, whether what is the consistency, whether there are any extra structures felt like worms-like structures, that is the varicocele. So and size, if they are very tiny, each one should be like a small egg size. What we this one, the volume should be 12 to 18 cc. If they are too small, report to the doctor. If one test is big, another is small, report to the doctor. If there is any hernia, hydrocele, where there is huge accumulation of the fluid, run to the doctor. Don't go to the doctor, run to the doctor, so that further damage can be avoided.
Yes.
So that is called as self-examination of the genitals. And also penis also can be felt every day or at least once in a month. See whether there is a hard mass inside the test. It's called as Peyronie's disease. So if it is detected early, they can be treated easily. Especially seminoma testis, that is the cancer of the testis, is easily curable if it is detected in the first stage or the second stage. That's why one should run to the doctor if they have got any tumor inside the testis. That is called as self-examination.
Right. Self-examination done. What happens if the testis is damaged?
Immediately they have to go to the doctor, surgeon, and whatever hematoma or torsion or tear or vascular damage or neurological damage, that will be immediately repaired by the surgeon, by the andrologist or the urologist, so that the structure can be replaced. Just like any other injury to any other organ, if it is attended immediately within few hours, the anatomy can be replaced. regeneration can be done. But if the injury is occurred and if the person goes to the doctor after 24 hours, tissue death would have occurred. Even if reconstructive surgery is done, the function may not occur. That is, if there is any injury, damage by sports, athletic, or due to accidents, bike accident, car accident, they have to get it repaired immediately so that the physiology can be restored.
Does this involve surgery also?
Yeah. No, if there is injury, if there is hematoma, if there is tear, if there is damage to the vessels, injury causing internal damage.
Right.
That has been.
Right. Here's another question. We talked about undescended testes, right? Is it the same as a man with no testes, or is it different?
Yeah. See, man with no testes is his diagnosis. He comes, I don't have testes. That is his diagnosis. Person, absent testes, is the diagnosis, that is clinical diagnosis. When we see the scrotum, if there are no testes, it is absent testes. Undescended testes is when we do the examination, by palpation, if we feel the testis undescended, that is in his groin, or by ultrasound examination, if the testes are detected somewhere in the lower abdomen, pelvis, or in the abdomen, or in the inguinal region, or even in the medial side of the thigh, then we call it as undescended testis. So undescended testis is a diagnosis done after the examination. That is diagnostic tests are done and it is declared where the testis is, where it is situated, what is the location, what is its size. That is diagnosis. The absent testis is the history. That is the patient comes and says, sir, I don't have testis. My scrotum is absent. Referring doctor, doctor who is practicing in the periphery sends to a sexologist or a urologist with a note that I am not feeling the testis in the scrotum. So that is clinical diagnosis. This is the diagnosis after the tests are concerned. That is called as final answer.
How rare is this? How rare is this?
The undescended testis we see in 1 to 2% of the population, about 5 to 10% in the infertile couple. That is infertile men.
And a man with no testis, how rare?
No testis, it could be hermaphroditism, that is the ambiguity of testis, genetic causes. The person may not be completely male. He may be she-male, that is, he may be XXY or XO syndrome, Klinefelter syndrome, or Turner syndrome. That is called as what we called as mixed dysgenesis. That is, there is some congenital abnormality of the genes itself, where the testis may not be present at all. Not undescended testis, no testis at all, just like no breast, no uterus, no ovaries. That is called as the sexual differentiation may be very difficult at that time.
And is this case also very rare, or
what we call it is LGBTQ, that is transgenders, that is mixed gender. The person may be half male, half female. So there may be breast, there may be penis also. There may be uterus, there may be little testis also. No testis, penis is there. So this is called as transgenders, that is LGBTQ, what we call it as a mixed gender.
And how rare is this to come across in real life?
Yeah, it's quite rare. Maybe 1 in 5,000 or 1 in 10,000 population. This transgender, that is genetic anomalies.
The real transgender.
It's quite rare, quite rare. But we see a lot of because they come to us. In the general population, but it is there maybe about 1 in 10,000. I'm not very sure about the statistics. I maybe check up. But what we see is, could be about 1 in 10,000 transgenders, undifferentiated sex.
Right. So here's a last question. Does a higher level of testosterone help to boost sexual drive or the desire to have sexual activity?
No, absolutely it is wrong to think that increasing the level of testosterone beyond the permitted level, it will not increase the sex drive or sperm, this one. Once the level of the testosterone goes above something like 963 international units IU, then inhibition starts. That is, there will be inhibition will release. The body will know that the testosterone is very high, and the reversal will start occur. That is, the testosterone production will decrease, and inhibition goes and tells the leading cells, which manufacture the test is that you have produced too much. Stop it. So there will be boomeranging effect. So one should not give the testosterone, the replacement of the hormone beyond the permitted value, because the rebounds phenomenon can occur, and even it may reduce the sperm if you give. That's why the athletes or the gymnastics or those who go to gym and do severe exercises. What happens is the testosterone level will go, and they may be taking anabolic steroids and testosterone also to build their body beyond their expectation. Then boomeranging effect can occur, and it may reduce the sperm count. Hence, whatever hormone replacement therapy we give, we should see that it doesn't go beyond the permitted level. That is called the range. So, for example, about the testosterone level should be about 143 to 968 international units or nanogram per ml. And if it goes beyond, or if it comes below, then the problems will start. So replacement should be done only up to the extent required, not beyond that.
All right. All right. Well, thank you so much for all this information. With that, we conclude.
Thank you, Jamie. It was a very nice interaction with you, and lovely questions you have asked. I feel that they will be extremely useful for the listeners, those who will see this video. So thank you very much for giving me an opportunity for an interaction with you and with all my fellow colleagues. Thank you very much. Good night.
Good night. Good night, Dr. Sharath. God bless you.
Thank you.
Bye. See you.
Bye-bye.
The good news is, I believe men can produce new sperm every 3 months with good lifestyle modification.
Yes, yes.
Right. Dr. Sharath, how will someone know if their, private parts are healthy or not?
Yeah. See, self-examination. Self-examination of the scrotum, testis, epididymis, and penis.
How?
Every day, when you go for the bath, when you are taking the bath, shower or bath, so, or even when you go to the urinals, toilet, just test both the testes. May not be daily, at least once in a month. You hold both the testes in your palm. Check up whether there is any extra growth. Once you start feeling the testes, you'll be knowing whether they are normal or not. And check up the size, and check up if there is any extra tumor, mass, or whether it is tender, pain. So if there is pain, then immediately go to the doctor. If there is extra mass, if you feel that something hard is there, something spongy is there, something abnormal, you feel that it is not normal, then you go and consult the doctor whether it is normal or abnormal. Many times one may mistake the epididymis for an extra mass. Then the doctor will tell, no, it is epididymis, don't worry. And feel the worms. If you feel lot of wormy-like structure inside, then you have got varicose vein. So self-examination, especially with a little knowledge about this scrotum,